Okay. Regarding the thyroidea artery again, if you fail to identify that properly, then you cut that without knowing, no? During neck surgery, no? Tracheostomy, for example, no? We can now see the trachea here. The thyroid isthmus was cut at the center. You can see the tracheal cartilage rings, no? The smooth muscles, no? In the tracheal walls, no? Going back to the thyroidea, no? If you cut that without knowing, no? And you forgot, you were not able, no? To perform proper ligation, no? And hemostasis, no? After it was cut, no? When you place tracheostomy here, no? Your bleeding, no? Your undetected bleeding can drown your patient's lungs, no? Or it can drown your patient, no? With his own blood. By the way, this connective tissue right here, no? This is part of the pretracheal fascial plane, no? The pretracheal fascia will basically cover, no? The visceral structures of the neck here, no? Including the thyroid gland, no? The trachea, and the esophagus, no? That is part of the pretracheal, no? Fascial plane, no? Behind the pretracheal fascia, no? After the esophagus, we have the prevertebral fascia, no? The prevertebral fascia, it was the fascia, no? That was removed, no? To uncover and expose the vessels and the scalene muscles, no? In this area. So let's go back to the midline once again. We can now clearly see that's the cricoid cartilage right there. The only cartilage, no? Here in the upper air passage that is a complete ring, no? The tracheal cartilage rings, no? Those pearl-colored structures that you can see right there. The tracheal cartilage rings are incomplete C-shaped rings, no? Posteriorly, no? The rings do not meet, no? C-shape, no? There's defect posteriorly, no? Why? No, because there should be room for the dilation or the expansion of the esophagus, no? Now, what lies below the trachea, no? Or behind the trachea? Behind the trachea, no? Right there is the esophagus, no? The trachea is air passage. It should be kept open, no? Most of the time, if not all of the time. So you have supporting cartilage rings that are stiff, no? To maintain its patency or to keep it open, no? For the esophagus, no? It will dilate only when we are swallowing food, no? Or whatever it is that you want to swallow, no? So blood supply to the proximal trachea and proximal esophagus. We have branches, no? Coming from the inferior thyroid artery, and our inferior thyroid artery again comes from the thyrocervical trunk, no? Thyrocervical trunk is branch of the subclavian artery. So this short muscle here, stretching from the cricoid cartilage, no? To the thyroid cartilage of the larynx. That's the cricothyroid muscle or cricothyroideus. Cricothyroideus, no? This is the cricothyroid membrane again, no? To provide emergency airway, no? For our patient in respiratory distress, no? Because of airway obstruction, no? At a much higher level, we can punch a hole here, no? Of course, you have to pass through the skin, no? It is the safest, no? And most easily identifiable spot, no? Where you can place your emergency airway. And we have very there's no major blood vessel that will cross the area, except maybe for very small veins, no? And some very small arteries, but we have no major vessel crossing the area, so that's a safe spot, no? For creating our emergency airway, no? So tracheostomy is performed here in the trachea, usually at the level between third, fourth, or fifth tracheal cartilage rings, no? So fourth and fifth, that's already below the isthmus. Okay, we have another short muscle right here, no? Attached to the thyroid cartilage of the larynx. And also the superior attachment point will be the hyoid bone. So that's the thyrohyoid muscle, cricothyroid or cricothyroideus, and we have the thyrohyoid muscle up here, no? So here, this is already the floor, part of the floor of the mouth. We have mylohyoid muscle in that area.